If you'll recall, we spent a number of months, in fact, longer than that, on the issue of Medicaid reform. And to Dale Ryder and Patty Bellock and our colleagues on the other side of the aisle, they spent a lot of time working on the whole issue of Medicaid reform because of the significance of it and the pressures on the budget. The governor, as he has said, and I quote from several articles, "I feel it is a mission to straighten this out for the next generation. We have to restructure our Medicaid and strengthen the pension systems. If we do that, we'll have more money for education, for public safety, for human services." And he continued for a period of time talking about the need to do Medicaid reform because it was landmark legislation. You'll recall in his budget address the need to get to the number of $2.7 billion to fill the hole on Medicaid. You have seen since the bill was signed in June of 2012, June 14th, the implementation of provider cuts to the tune of $300 million, the implementation of the cigarette tax to raise $700 million, the paying down of old bills. But one of the areas that we have not seen movement is the implementation of the cuts in Medicaid. And we are now 2.5 months past the signing of that bill. And if we are going to have to be able to fulfill our budget to get the numbers that we want, get to the numbers we want to, we have to have full implementation. And one of the areas that I use as an example is the issue of scrubbing that takes people that are ineligible on the rolls off. And that may be because of income, it may be because of residence, it may be because of age. And we plugged in, and again, to the credit to Dale and Patty and others, and again on both sides, and to Julie Amos, we plugged in a number of savings of $350 million. Some would have said we could have even gone higher than that. There are some that said we could save $700 million, but because of a collaborative effort, we agreed on the number of $350 million. To date, they have not even started the process, and other than to reach out to a company, and that we're now told it will not be until January of next year that they will start the implementation of the process of scrubbing. It's has been the pattern of this administration to come back before the General Assembly and say to both chambers, I need more money, we're not going to be able to get through the budget year. And we're saying fulfill the budget, fulfill the commitment on Medicaid. It is landmark legislation. Let's get it done. And you knew this was the issue. You knew it was something we talked about for months, if not years. And to put this off until January of 2013 is unacceptable.